Thank you, Holly. It's really a pleasure to be here and to speak to you tonight about your life after cancer and how to manage your dental health. So often when you're going through cancer therapy, what's going on in your mouth sort of gets set on the side table, and it's really important to look at your oral and your systemic health as part of your total health. So as Holly said, I'm a registered dental hygienist, and sometimes people get a little confused as to what a dental hygienist actually does, because when you go into the dental practice, there are a lot of people working there. You have the dentist, and you might have the assistant, but you also have the hygienist. So the hygienist focuses on oral health promotion and disease prevention. So we really are the oral health educators and promoters of good health in the dental practice setting and also beyond. A dental hygienist is licensed to practice dental hygiene, and in terms of what we do for patient care, we'll be responsible for oral and general health assessments. So we always ask you about your general health as well as your oral health. We perform periodontal therapy, caries or decay prevention. We will take dental radiographs and then also provide you with oral health education, all within the confines of your routine dental hygiene appointment. So really ask your hygienist about your oral health, but also about your systemic health as well. So in terms of my lecture this evening, I don't have any disclosures. I'm not affiliated with any of the manufacturers or the products that I might mention tonight. And I do have some samples over on the side table so that when you're finished tonight, be sure you go by the table and look at the different things that are available. You may find something that will work for you with your particular situation. So in terms of tonight's topics, I'm going to be talking about oral and systemic health connections, sort of an oral health 101 as well, talking about periodontal disease and dental caries, and providing you with some good basic information that you can also apply to whatever your particular situation with your life, either during or after your cancer therapy. Then we'll talk a little bit about oral complications that are due to cancer therapy, some oral mouth care strategies that you might want to try, and then some oral care resources as well. So once I'm finished with the presentation tonight, then I can address some personal questions that you might have along the way. So let's go ahead and get started looking at the prevalence of oral disease. And it's interesting to note that 1 out of every 2 American adults aged over 30 has some sort of periodontal disease. So 50% of the population. And that's 50% without any sort of specific diagnosis of a cancer or other systemic disease. So it's a very common disease occurring in the mouth and sometimes really overlooked. So what are the signs and symptoms of a periodontal disease? Well, often it can be very silent, but looking at tenderness, redness, or swollen gums, those are very common signs of the initiation of periodontal disease. As it advances, you may not feel anything, but you may experience some significant bone loss with it. Bleeding gums, the tissue pulling away from the tooth itself, and halitosis and loosening of the teeth are signs of advanced periodontal disease. What we know about periodontal disease is it's very prevalent, non-communicable disease that's chronic within the population. So if you look at the fact that 50% of the population has periodontal disease, when you have a diagnosis of cancer, that can also impact your periodontal disease status as well. So we look at our oral disease in terms of systemic disease, and we know that Oral disease is related to cardiovascular disease, rheumatoid arthritis, Alzheimer's, and even some cancers. So there's some research out there showing that oral systemic link. And then looking at tooth decay. Go back here one more. There we go. Tooth decay, it's the most common chronic disease in both children and adults. So, and its prevalence, even though we've had fluoride in the water and fluoride in toothpaste for a long time, the prevalence of tooth decay is actually increasing in the population, especially in young children. And once tooth decay has been established, this disease requires treatment, because untreated decay can lead to an overall systemic infection. There have even been cases of children that have died due to advanced tooth decay. So again, those oral systemic health links are very prevalent. So cardiovascular disease, advanced periodontal disease can impact your diabetes if you have a diagnosis of diabetes. Respiratory and lung disease are influenced by bacteria in the mouth, and even complications in pregnancy. So what happens in periodontal disease is that you have the gram-negative bacteria in the gingival sulcus, that space between the tooth and the gum, and that gram-negative bacteria can go into the bloodstream. And the inflammatory cell mediators from the gram-negative bacteria can have an impact on your systemic health. So looking at the main culprit of oral disease, it's that dental biofilm or plaque. So if you look at the microscopic picture of the dental biofilm, it looks pretty impressive there. These very organized colonies of bacteria, over 300 different species that are in the mouth that are organizing themselves 24/7. So if you brush, or even if you see your hygienist in the morning, by noontime that bacteria is reforming, reorganizing on the tooth structure. So in the early stages, the biofilm is primarily gram-positive cocci and rods, so not very harmful. But after only 5 days, you have a shift to gram-negative bacteria, so much more pathogenic. So bacteria that gets caught down in that space between the tooth and the gum, the sulcus, can develop into being very pathogenic. So that's why the use of the dental floss or proper use of the toothbrush down in that space is really critical. So you can see as the biofilm matures, so you have this colony with water flowing through the bacteria, and the bacteria multiplying and then breaking off, and sometimes getting into the bloodstream. So looking at periodontal disease, we want to look at the inflammatory infection that occurs as that bacteria becomes established in the gum sulcus, or that space between the tooth and the gum. And once the bacteria is established there, then the enzymes are produced that destroy the ligaments and actually cause tooth loss over long periods of time. So you can see on your right the picture, the cross section of the tooth, and how the tooth sits in the jawbone itself. So if you look here, you see the little ligaments that are holding the tooth to the bone. And when you have periodontal disease, you have destruction of those ligaments there, and you can have destruction of the bone. So on this On this right side, you can see where the periodontal probe, which is a measuring device that measures the distance from the top of the gum to the actual attachment point, where the ligaments are actually attaching to the tooth. So on this right side, this schematic shows a 6 millimeter defect. So here's the top of the gum, but there's the attachment. So it's 6 millimeters down. So that's a pretty significant space that gets filled with bacteria. So as you're doing your oral hygiene practices, you need to be able to clean in that space. Otherwise, that gram-negative bacteria proliferates and can cause further destruction of the periodontal ligaments. Okay, and over on this other side, that's a perfectly healthy tooth on that side. So you know when you see your hygienist, they often do your pocket measurements or your periodontal probing. So that's exactly what's being performed, is measuring the distance from the top of the gum to the actual attachment point to the tooth. So on the other side, we want to look at tooth decay, which is an infectious disease process caused primarily by Streptococcus mutans and Lactobacillus bacteria. And the thing to remember about tooth decay, which we didn't know even 25 years ago when I was a student, was that it's a dynamic process, okay? That it's not something that just happens on a single incident, that it's an ongoing process of demineralization and remineralization of the tooth structure. So the tooth can be demineralized, so the minerals are leached out of the tooth, but if you have the appropriate mix of minerals in your saliva, you can actually remineralize that tooth structure. So it's a dynamic back and forth process. And if you look right here, you can see this is the initiation of tooth decay into the enamel of the tooth. Okay, once it gets through the enamel and into the dentin, it needs to be treated quickly, which you can see here as the location of the nerve and the blood supply of the tooth. So untreated tooth decay can allow bacteria to go into the bloodstream and then here down into the jaw area. So when we look at tooth decay, we want to look at the balance of the decay process. So you have these pathologic factors, or the bad things, which is the bacterial infections. So you need to have those strep mutans and the lactobacillus. You need to have the absence or lowered levels of saliva. And you need to have the diet that is going to be promoting the tooth decay. So if you are eating a lot of refined sugars or even the more complex carbohydrates, because the digestive process begins in the mouth, then you are producing more acids that will feed that bacteria and also initiate that demineralization process. So here on the other side, you have protective factors such as saliva and sealants. Sealants are protective coatings that are placed on the biting surfaces of teeth, particularly in children as their teeth are developing. Because if you think of the occlusal surface, the biting surface of the tooth, and you have cusps that come down like this, then down in that pit area, you don't have a lot of enamel there. So that's a vulnerable area. So by painting a sealant, which is the sort of the equivalent of a nail polish that's hardened onto the tooth, you're protecting those biting surfaces from the initial decay process. Many times in adults, because we didn't have the benefits of fluoride as we were growing up, we have had tooth decay in the biting surfaces of our teeth. So that's one reason why you don't often hear the recommendation that you should have a sealant placed on one of your molars, because unfortunately you've already had a decay experience there, and you may have a filling or even a crown on that tooth. So what we want to avoid is that happening, and especially in kids. So sealants are often placed on those teeth. Then you have antimicrobials, such as a mouth rinse that is directed to reduce the overall amount of bacteria in the mouth. We'll talk a little bit more about that as we move through our presentation tonight. Also, fluoride. Fluoride will remineralize those tooth surfaces and actually make the tooth more resistant to decay. And then also an effective diet, so a healthy diet. We're going to talk a little bit more about diet, so that often when we think of tooth decay, the first thing we think of is what? Sugar, candy, sweet things. But looking at the role that acids and the role that the pH plays in the diet is really critical. So that's actually a really important takeaway for you tonight, is to be thinking about the role of the pH in your own saliva, in your own mouth, and the role that plays in either protecting you from future decay activity or promoting it. So let's talk about saliva. It's often, when you think of kids, everybody thinks, oh, your spit. That's just something that everyone wants to laugh about. But saliva has such an important role in our oral health, and it's only when you don't have adequate saliva that you really realize the impact that your saliva has on your total health. So it lubricates and protects your oral tissues. But even more important than that, it has a buffering role. So that buffers the changes that occur in the mouth depending on what kinds of foods and beverages that you eat. It's also very important in maintaining tooth integrity, so the overall structure of the tooth. It has an antibacterial activity as well, and is really important in taste and digestion. So anyone that has gone through any sort of radiation or any chemotherapy or taking medication that affects their saliva, you'll notice that not enough saliva really impacts the total quality of your daily life in so many different ways. So looking at what's in saliva, what is in that liquid substance that's in the mouth? There's serous and mucinous components to the saliva. So serous is the fluid part, mucin is the mucus part. So in serous saliva, 99% of it is water. Then you also have mucin, and then electrolytes, including sodium, potassium, calcium, magnesium, bicarb, and phosphate. So a lot of different electrolytes are in saliva. So if you don't have enough saliva, you're going to also be deficient in all those different electrolytes as well. And then saliva has enzymes. So amylase, the enzyme that digests starch or carbohydrates, is in saliva. And then we also have immunoglobulins and proteins. So a lot of different complex components of spit. Okay? And here, this little one, she's got lots of saliva. It's drooling. As when you think of a baby, you think of saliva drooling and just flowing out of the mouth. So where are those salivary glands located? It's really important to take a look at where your salivary glands are, where they fit in your whole head and neck anatomy. And also when you go for your routine dental hygiene care, that the hygienist or the dentist is actually palpating those salivary glands and your lymph nodes as well. So looking here, right here at the cheek, it's the parotid gland. So it's primarily serous saliva and accounts for 25% of the overall volume of saliva in the mouth. So anyone that's had any sort of interruption of the parotid gland, if it's been a tumor or if you had radiation here, that would account for about 25% of your salivary flow. And then here down at the base of the mandible is the submandibular, which is also serous and mucinous, and it's responsible for 55% of your total volume of saliva. And then here forward is the sublingual, and that's also a combination serous and mucinous, and that's 10%. And then throughout the mouth, you have minor salivary glands that are primarily mucinous in about 10%. So you know if you've had any sort of radiation therapy, it can really impair your salivary gland function depending on the direction of the beam and how much exposure those salivary glands have had. So it's important to know your anatomy, know where things are, and also to have it routinely checked because you can develop lesions in any of those areas as well. Okay, few fun facts about saliva. You can share them with your friends. Is that in health, you produce between 500 milliliters to 1.7 liters a day. 1.7, that's a lot of saliva. But it's important to have, okay? So that breaks down to about 0.25 to 0.35 milliliters per minute. And it's important, I mean, sometimes you can have your flow measured if you are, if you have xerostomia issues, or if you have tooth decay issues that don't seem to have, you know, any sort of real known cause. Your hygienist or your dentist might do a flow test, so to see how much saliva you're actually producing. The flow is going to be greater when you're standing versus sitting. Don't ask me why, I don't know. It's going to be higher in cool versus hot weather. Doesn't make sense, does it? And then the highest flow is going to be in the middle of the afternoon. Now here's the one that everyone can clue in with. The lowest flow is going to be about 4 o'clock in the morning. Now if you have dry mouth issues, you'll notice that you'll wake up in the middle of the night because dry mouth. But it's going to be lowest at about 4 in the morning. Okay, so not only is quantity important, but the pH. The pH is critical. So neutral or basic saliva has a pH of between 6.3 and 7.0, right at that midline level. Acidic saliva is between 5.5 and 5.0. So that's really the critical point, that after that you start to demineralize the tooth structure. So you start to leach the minerals out of the tooth when you have an acidic saliva. So with that, the acidity promotes an environment that is very conducive to the lactobacillus and the streptococcus mutans. So those bacteria, out of the 300 or some odd bacteria that are in your mouth, the two that are most critical for tooth decay are the lactobacillus and the strep mutans, and they really like an acidic environment. So if you have an acidic saliva, then it's going to promote the growth of those bacteria and initiate that demineralization or decay process. So looking at the different things that we eat and drink, particularly drink, this gives you a really a good guide of the pH scale. So battery acid is up there at the top, pH of 0. But then your stomach acid is right next to it. So people that have GERD and are regurgitating, or if you have a lot of issues with vomiting through your cancer therapy, it is critical to the pH in your mouth, because if you're vomiting a lot, then it's really lowering the pH in your saliva and creating an environment that's more conducive to decay. So looking at lemon juice and vinegar, so people that are sucking on lemons or using lemons as a refresher really lowers the pH significantly. Orange juice and some dental mouthwashes can be acidic, so know the pH of what you're using. Tomato juice and beer are right there at 4. Black coffee also has an acidic pH. So if you're drinking a lot of coffee all day long, you're keeping your oral environment acidic. Even if if you're putting sugar into it, well, that's adding fuel to the fire. So you need to know what it is that what you're consuming. And then looking at saliva there on this chart, it is pH of 6, which is fairly neutral. Cow's milk is also neutral. So that leads you to think, well, if you have a lot of acidity, drinking milk can be really soothing and also pH neutralizing. So being a smart consumer on what you're actually ingesting. Looking down for neutralizing salt water, neutralizing rinses, baking soda. Baking soda is really helpful. We'll talk a little bit more about that when we talk about things you can do during treatment or when you are having a lot of problems with acidity in the mouth. And then antacids, and then some treatment rinses, and then down there soapy water. I don't think we're going to be rinsing with that. Okay, but that pH, the thing to remember is pH of 5.5 is that critical level when you start to demineralize the enamel on your tooth. Now, if you have a lot of root surface exposed on your teeth, which as we age, the gums will tend to recede or shrink down a little bit. So you have roots that are exposed. The roots are covered with cementum, which is a lot softer than enamel. That's why as we age and have issues with dry mouth, root caries, so decay on the roots of the teeth, become a real issue for the aging population or anyone that has recession. Okay, so looking at the saliva and the pH and decay. So looking at what you're eating, the time factor involved, and the rise and fall of your pH in your saliva. So you want to know how much should I eat and when should I eat it? So if you look at the top, if you eat a bag of trail mix all in one sitting, so you decide I'm going to have my snack and you do it all in one go, that's actually better for you than those little snacks that you take at the desk or wherever you are. Take a little handful now, and then if you're walk another 10 minutes and you take a little bit more. So if you do multiple settings, you've got this rise and fall of your pH, and you have the demineralization, remineralization, demin, remin going up and down like this. So definitely the top is the better approach. Okay, now let's look at the saliva and your oral health. So looking at dry mouth in general. 25% or more of all adults have some issue with dry mouth. It increases as we grow older. It's also involved with systemic disease. So different systemic diseases will have xerostomia or dry mouth as part of the disease syndrome. But the big factor with dry mouth are prescription drugs. With the prescription drugs, there are 42 different drug categories and 56 subcategories, which boils down to lots of medications have dry mouth as a side effect. So depending on what medication you're taking, you may or may not have that side effect, but it's always important to evaluate what your salivary flow is like after you start taking a medication, because it's really very critical. And you can see here with that mouth up there and that tongue, it just looks dry to look at it. But a big issue with dry mouth is xerostomia that follows radiation therapy. So if you're going through radiation therapy for any sort of head and neck cancer, dry mouth is just part of the therapy because of the effect that the radiation has on the salivary glands. So initially, the reaction will be much more acute. So it's causing inflammation in the salivary glands. And then later on, as you have completed your therapy, you may develop fibrosis of the salivary gland. So limitation of the salivary gland to produce the saliva. And also some alterations in the cells that are responsible for secreting the fluids. So with radiation, it's a common side effect. With newer techniques with radiation, it's much more focused, so you don't get as much collateral damage of the accessory glands, but it's still a common problem with any sort of head and neck radiation therapy. So this is what can happen with exposed roots. Yes, it's not a very pretty picture. So if you have a situation where you do have, oh, sorry. I'm confused now on my slides. There we go, sorry. This is a different driver. So, okay, so we look at tooth decay and dry mouth. What will make you higher risk are exposed root surfaces. So if the root surfaces, if you have the gums that have receded a bit down on the root of the tooth, exposing the root surfaces, those root surfaces, like I said earlier, they're covered with cementum. So cementum is a lot softer than enamel, so making them much more vulnerable. So you add in bacterial plaque that is attached to the root surface, and then a pH that might be in the acidity range, so acidic pH, and then whatever else you're eating or drinking can make the tooth decay process can be accelerated very fast. So in this case, I can also tell you of individuals that have gone through head and neck radiation therapy, younger individuals with no recession, that their risk for root caries or radiation caries isn't as great as someone that has exposed root surfaces. So it really depends on where your oral health status is when you enter your therapy. Yeah, so your oral health issues, whatever you had going into your cancer therapy, it doesn't disappear because you have another disease process that you are fighting. So unfortunately, I mean, it's something that, we have to pay attention to, as well as our treatment issues, is what's going on in our mouth as well, and not neglect it. So there we go. Okay, so looking at oral complications of cancer therapy, who's going to get the side effects? So if you're going through radiation therapy to the head and neck, you guaranteed will get some side effects, some reduction in the salivary flow. You may also develop mouth sores as you go through the treatment process that can be really debilitating, and other issues that can develop after your treatment. And then anyone who's receiving a bone marrow transplant will also be highly susceptible to oral side effects as they're going through their therapy. And then certain types of chemotherapy that causes a prolonged bone marrow suppression may make you more susceptible to oral side effects as you're going through the treatment. Now, oral complications. When you face a cancer diagnosis, I mean, you've got a lot of things on your plate. You have a life-threatening disease that you are having treated, and then on top of that, depending on what your oral health status was to begin with, you have your mouth to worry about too. So complications as you're going through treatment can really compromise your overall health and the quality of your life, because if you have any sort of lesions in your mouth, even without a cancer therapy going on simultaneously, it can make you pretty miserable. If anybody's ever had aphthous ulcers or canker sores, you know that it makes eating really hard. So you add, oral lesions on top of working your way through your cancer therapy, it can really make you very unhappy and very miserable. They can be short-term effects. They can also be long-term effects. So oral mucositis that can occur with some chemotherapies and definitely with many radiation therapies can compromise your life to the point where you might have to have a feeding tube or something to get nutrition while you're going through your cancer therapy. Then dry mouth issues, tooth decay, tightness of the jaw can occur with head and neck radiation, and that can proceed following your therapy and years after. And then bone infections. So you may be susceptible to bone infections because of your cancer therapy. So looking at what sort of mouth care basics, and then we'll talk a little bit more about more of the specifics. General guidelines for your brushing, or what we call de-plaquing. So think of brushing as removing the plaque that's forming in your mouth. And it's really important to brush gently and brush regularly using the right equipment. You all know that if you're doing anything, it's all about the equipment that you have. And many times we go home from our treatment and we're not really paying that close attention to the toothbrushes in the bathroom because you have a lot of other things that you're thinking about. But using a soft toothbrush, and one that is really genuinely soft. So I have some samples over at the table. So when we're finished tonight, come over and take some and take a look at what a really soft brush is like. And brushing after eating is really important to remove the food that's still left in between the teeth, but also to disrupt the plaque. And then rinsing with water when brushing isn't possible. So many times when we focus on our mouth care, we look at products. We look at what kind of toothpaste we use. And that's often the question that people will ask, what kind of toothpaste should I use? And it's really about your technique that's going to really get the plaque off. The toothpaste is great for doing other things, but it doesn't remove bacterial plaque. Okay, so that's an important thing to remember. So the question always comes up, should I get should I have a manual brush or a power toothbrush? Well, it's really how you drive your brush that's going to make the difference. So if your mouth is comfortable with an electric toothbrush and you're able to position it properly down at the gum margin, then using a power brush might work well for you. But you can also achieve good plaque control with a manual toothbrush. It's really important to go back and look at, okay, where am I supposed to be focusing my brushing? Even with my daily patients that I see in practice, people have all kinds of great equipment, but if you don't know where to position it, it's not going to help you. So knowing how to drive your brush is the critical piece. Getting the brush bristles directed into the gum sulcus, that space between the tooth and the gum where the bacteria is growing, where that gram-negative bacteria is proliferating, is the important area to brush. Taking care of your toothbrush. I can't tell you how important that is. And replacing your brush frequently, whether you're going through cancer therapy or whether you're on the other side. Replacing the brush frequently, looking at the integrity of the brush bristles. So when I say integrity, I mean if the brush bristles were straight when you bought them and they're flipping out on the sides like this now, they're not going to work for you. It's just not going to do the job. And it's always interesting when you go to visit friends, and if you end up in the family bathroom, which is not where you want to send your dental hygienist friend, not into the family bathroom, because you say, oh my goodness. Or even when I have patients come in and they have, brought their own toothbrush to use before they come in to see me, and that's what you use? Well, okay, I can see why you're having a little trouble there. It's having the right equipment and using the right size brush, something that is nice and supple, not too big, and letting the brush dry out between uses, having several that you use so that you're rotating, so you're not using one that's all wet on the second brushing with it, because if you do, then the brush bristles will tend to splay or bend quicker. And remember, you want to direct them down into that space between the tooth and the gum. So I always recommend that patients consider buying brushes in bulk. Be a smart shopper, go online, get the right kind, get a dozen, it'll last you a long time. And as you're going, if you're in the process of going through chemotherapy, replacing the brush after each cycle is really important as well. And also replacing brushes if you've been ill. If you've been sick, you got all that bacteria in the brush, okay? So that's not a healthy thing. So if they look like this, or even like that, time to discard and get another one. Then cleaning in between the teeth. That's always the question when even patients present in the office and they want to tell you their confession before you even look inside their mouth, which is, I haven't flossed. You have to look at it's interdental or in between the teeth cleaning, and remembering that if you look at the tooth, if you look at your back molars, they're like these rectangular squares, so you've got a lot of space in that in between area. So you can get on the outside of the tooth and on the inside of the tooth, but that area interproximally, it's really difficult to access. So looking at what's going to work for you. So floss is not always the be all and end all. You might want to use an oral irrigator or a water jet or something that's going to reduce that bacterial load that's developing in between the teeth. Toothpaste. Remember, toothpaste does not take care of biofilm, so that plaque biofilm is not destroyed by toothpaste. It's important to use a toothpaste product that's going to have fluoride, because why? The fluoride is going to help to rebuild the enamel. Remember, the enamel is, you're demineralizing and remineralizing all day long. So you want to add back to the mineral content in the tooth. So fluoride is a great additive. You want to look for a toothpaste, possibly one that doesn't have sodium lauryl sulfate in it, because sodium lauryl sulfate is the foaming agent in a toothpaste, and it's also associated with oral lesions or ulcers in some susceptible people. So be on the safe side. Look for a product that doesn't have SLS in it, sodium lauryl sulfate. And you'll find if you're going through a period where you have mouth ulcers, using toothpaste can be really painful. So what's the way to get the plaque biofilm off? Mechanical action of the toothbrush, okay? And if you're finding that the toothpaste is really burning, then you might want to switch to like a neutral fluoride rinse or something else. But don't feel like, oh, I can't take care of my mouth because the toothpaste burns. You can still take care of your mouth possibly with a really ultra soft toothbrush, and it's the brushing action. It's that mechanical action that is going to disrupt the biofilm. The toothpaste is a great chemotherapeutic for the tooth structure, but it's not going to remove the biofilm. And I think that really helps too. So if you think of either dry brushing or brushing with a warm toothbrush that's, if your mouth is really tender, dipping the toothbrush in warm water and then brushing with it, and brushing frequently. How do you know what's in your toothpaste? There's a good way to find out is you can go to this website that's from the National Library of Medicine, NIH, and you just plug in the name of your product, and it will give you the whole drug label. So if you're looking for a specific product, then you can just go to Daily Med and find out what's in it. Now, you may have the recommendation from your either your oncology team or from your dental team to use a prescription fluoride product. There are a number of them out there on the market. This one happens to be from Colgate. It's called Prevalence, and it's very helpful to use to add more fluoride into the tooth structure. So over-the-counter toothpaste has about 1,500 parts per million fluoride. But a product like Prevalence has 5,000 parts per million. So it's super saturated with fluoride. So you can use it as a toothpaste. You can use it after brushing with whatever your regular product is and apply it. You can also use it in the little custom trays that can be made by your dental office. So these are these fluoride trays for home application. So it may be that your dentist or your hygienist has recommended more fluoride therapy because you have all of these exposed root surfaces that are more vulnerable to tooth decay. So you can put the fluoride in the trays. Sometimes as you're either going through therapy or after therapy, you find the trays uncomfortable, so you can just apply the paste. And the paste it's more of a watery compound than the really thick toothpaste in the tube, so it's more fluid to it. So the more you brush it around, the better the uptake is going to be. The other thing that your dental office might recommend is the fluoride varnish that's painted onto the tooth surface. That also, it's a 5% sodium fluoride. You paint it on and it sticks onto the tooth for about 4 to 6 hours. So it's like the equivalent of brushing with a fluoride product for about 4 to 6 hours. So a lot longer than you're going to be standing there with your toothbrush. And it's a very simple thing to apply. So on those vulnerable surfaces, so like I say, if you've got a lot of exposed root surfaces or if your teeth are really sensitive, this product can be very helpful. Okay, so another thing that you want to know about, many times you may have a denture or some sort of removable appliance. So teeth that are on like a retainer, a partial. And those need to be cleaned on a regular basis in an antimicrobial solution. And the reason behind that is that your dentures or oral appliances are a source of bacteria. So you can get a lot of bacteria growing underneath the denture. And Candida albicans, which is a fungus, is also very common in a denture. And with a candida infection, you'll have pain, burning of the mouth, alterations in taste, and an infection. So it needs to be treated. It's really important with any sort of appliance in the mouth that you take it out for sleep at night. Letting the tissue breathe is so important. And while the tissue's breathing, then your appliance can be soaking in a solution to remove the deposits and the bacteria. Yes, and if you have any sort of mouth lesion, you want to remove it during that acute pain period as well. And obviously consult with your dentist, but taking the appliance out at night when you sleep is critical because then you allow the tissues to breathe. Moisturizers, keeping the mouth moist is important. So drinking lots of water, and particularly if you've got xerostomia due to your cancer therapy or due to medications, drinking lots of water is critical. One thing about the water is at night when you sleep, there's a type of water bottle that you might want to look into. And I think the manufacturer might be Camelback, but it has that sort of reverse flow protector. So it's got like a straw in it. You can squeeze it and it prevents the water from flowing back. So you don't have to sit up all the way in bed to get your water. So it's a good thing to look into. In terms of mouthwashes, you want to be careful about the different products that you might be using, making sure that they're alcohol free, because alcohol obviously will dry the tissues out. And then there are saliva substitute products that are available to moisturize the mouth. There are lots of products out there on the market. And really the best thing you can do is just try different things, because what works for one person may not work for the other person. So knowing what's available and just sort of being willing to try the products. And then as far as eating and drinking, you want to eat and drink with care because during certain periods of therapy and afterwards, the tissues are really friable and susceptible to ulceration. So soft and easy to chew foods are important. Avoiding spicy and crunchy foods. So often, I mean, you know what you crave, but then on the opposite side, you know what it might do to your tissue. So you have to kind of turn in a different direction, looking for other things that are going to give you the nutrition that you need, but not exacerbate any sort of oral lesions. Limiting caffeine. Caffeine is really drying to the tissue. It's a diuretic. So drinking coffee all day is probably not the best thing to be doing. Lukewarm foods and drinks instead of hot or icy cold. Don't, go for the extremes, right in the middle. And avoiding alcoholic beverages as well can be important. Again, dries the mouth out. And then watching your fluid intake is critical. Drinking water is so important. And then in terms of tobacco products, we don't even really have to go into that in any depth or detail. We all know that tobacco isn't good for our health. And if you are still, using tobacco, you want to try and look into the tobacco cessation resources that are available either through the hospital or there's California Smokers Helpline, and there's also smokefree.gov. This website I thought was really excellent. You have to go there and use it for it to help you, but there's a lot of things on that website that will really help you with your tobacco habit. They even have smoke free for young people as well. And of course, they're the new generations of tobacco users. So just knowing those resources, I think, is really helpful. Okay, so what do you do if you have a sore mouth and a sore throat? Rinsing with baking soda and salt water can be really soothing. So looking at warm water rinses with a combination of a half a teaspoon of soda, half a teaspoon of salt, and then a quart of warm water can be really soothing and also neutralizing. Remember, getting that pH back to neutral is critical. And then following up with plain warm water. So warm water is really soothing and healthy for you. Dry mouth, the same, rinsing often with water and then using those over-the-counter sprays and rinses that can be so helpful. And then there are some sugar-free lozenges you can try, being careful that you pick a product that's not going to contribute to your acidity in your pH. Chewing xylitol gum. If you're able to chew gum, xylitol gum is really helpful. And then the saliva substitutes that are available as well. So in looking at the products that you select, select them with care, because somebody that's using Altoids, knowing what's in an Altoid, you can really accelerate the decay process. So you don't want to go there. But there's another product called Xylamelts that actually has xylitol in it, and the lozenge can stick right inside the cheek and then help produce moisture as long as it's stuck to the buccal mucosa. So I have some samples of the xylitol or the Xylamelts and some information on that particular product. So I found with some of my patients that this is very helpful because it helps to create moisture in the mouth. These are definitely high-risk habits. So looking at, saltine crackers can sometimes be really helpful if you have an upset stomach. But if you have a lot of saltine crackers still stuck in your teeth, remember back in the day when you took biology, what's that first experiment that you did about digestion? Was taking a saltine cracker and chewing it and chewing it and chewing it, and then you can feel it, you can sense it as it becomes sweet because the enzymes have started to break it down. I even have a patient who used to wake up in the night with an upset stomach, and he was using saltine crackers, and he came in for his appointment and he had a lot of new decay. We thought, what's going on here? And then he shared with me, he said, oh, well, I've had this, problem at night. I can't sleep. I get up and, I just sit and have some crackers and then I go back to bed. So you need to be careful about the different habits that you have, even things that on the surface look like they might be healthy. So then even if your lozenges are sugar-free, but if they're citrus, that's going to lower the pH. So you need to be able to be careful as to what you pick. Okay, in terms of oral infections that can develop either during treatment or post-treatment, again, looking for alcohol-free antibacterial rinses. These rinses are used to treat periodontal or gum infections, and the product that's available is a chlorhexidine gluconate product. It's not used to prevent infections. The research that has been done on chlorhexidine shows that it isn't good as a preventative, but definitely if you have an infection, that's when you want to be using it. And there is one chlorhexidine product on the market that's from the Butler company that is alcohol-free. The rest of them do have alcohol in them, so you need to look at the label and make sure that what's being prescribed is right for you. Other complications are the jaw joint stiffness or trismus. And if you are going to develop jaw joint stiffness, it will reach a peak about 3 to 6 months after treatment, and that's with head and neck radiation. And it is important to do those daily stretching exercises both during and after your treatment by opening and closing your mouth as far as you can without pain. It's also a good exercise just to do because it keeps the TMJ, the temporomandibular joint, really supple, opening and closing. And if you do have TMJ pain, then applying warm, moist heat can also be really soothing to that area. But doing your exercises is important, even long after your treatment, to continue on with those jaw exercises. Sensitivity. Sensitivity can be a problem during chemotherapy. Can be this deep aching pain that it feels like a toothache. But when you look closer, there isn't really a dental source for it. And sometimes the effect of certain chemotherapy drugs can affect the nerve tissue and cause a dull aching pain. So the easy remedy for that is to use some of the sensitivity formula toothpaste. So in looking at a sensitivity formula toothpaste, there are a lot of them on the market. You want to look for something that has potassium nitrate in it, which is the active ingredient in most of these products. Potassium nitrate is thought to depolarize the nerve endings deep inside the tooth structure. That's how that one is thought to work. So you use the toothpaste, it permeates into the tooth and into the inner structure of the tooth. So if your sensitivity is related to your chemotherapy, that may help to relieve it. And then using topical fluorides also help to occlude the open tubules, so these little pores that are open out on the root surface. Fluoride can help to close those off and eliminate that source for sensitivity. And then the fluoride varnish. So easy things that can help to eliminate or alleviate sensitivity during therapy and afterwards as well. Okay, osteonecrosis. And you've probably all heard about osteonecrosis with bisphosphonates. Sometimes bisphosphonates are used intravenously during cancer therapy, and they can be a problem both during and after treatment. So osteonecrosis is actually the sloughing away and death of the bone in the mandible or the maxilla. And sometimes the lesion can be triggered by either some sort of insult like a tooth extraction, or it can even be triggered by, a trauma from a chip or something that's going to cause the tissue to become opened up. Death of the bone tissue can be a really uncomfortable, obviously, side effect of your treatment. With the osteonecrosis, the approach is to reduce the risk of initiating the lesion. So many times the oncologist will recommend that if you have teeth that look like they may potentially need to be extracted further down the road, that those teeth be taken out ahead of treatment. So sometimes it's done to prevent issues with osteonecrosis. And then also you want to avoid the risk of initiating the lesion during treatment, so by avoiding hard and soft tissue trauma. So if it does occur, looking at how to manage the symptoms of it, using saline rinses, antimicrobials such as the chlorhexidine, and then often physicians will recommend hyperbaric oxygen therapy, which may help with the wound healing and pain due to osteonecrosis. And there's a recent position paper that's been written by the American Association of Oral and Maxillofacial Surgeons on osteonecrosis, because it's becoming quite a problem with IV bisphosphonates and also oral bisphosphonates. Okay, so after treatment, good oral hygiene practices really prevail. So maintaining that recommended oral hygiene program for obviously decay risk reduction, reducing your risk of tooth decay. So remembering that radiation-related caries can progress within months. And in this case, looking at the initiation of the lesion is down here right at the root surface. And even in this case, this person doesn't have extreme recession, but it's right down there at the root surface where the enamel and the cementum meet, and where you don't have as much enamel thickness. Also, looking for regular professional care. So a collaboration with your dentist and your hygienist. So creating a continuing care, so ongoing care based on what your needs are. So it's not really a cookie cutter approach where, every 6 months, but really doing a risk assessment of your personal risk, what your oral health looks like, and what's best for you. So on a case-by-case basis, looking at decay and periodontal risk. And then managing your oral complications related to therapy as you finish therapy. Sometimes you might go in every 2 to 3 months in the first year to 2 years, and then later on extend the time period out. But it really depends on your individual situation. Looking also, again, the enamel remineralization strategies, so looking at using a prescription fluoride toothpaste, maybe the tray application, looking at xylitol, which again is that alcohol sugar. The benefit of xylitol is that it can be bacteriostatic. So reducing or keeping the level of bacteria in the mouth at a static level. You do have to look at the amount of xylitol that is necessary. It's not just the little amount that's in a gum, but an adequate dose can be helpful. And then the calcium products, there are a lot of calcium products out on the market. And then obviously risk reduction, avoiding acidic foods and beverages, looking at the refined sugars, looking at what your beverage intake looks like. And I ask my patients all the time, tell me about what you drink during the day, in between meals, so I can get an idea of what's going on here. And then with your fluoride, again, this is the varnish, looking at how it remineralizes the enamel and disrupts the Streptococcus mutans, those decay bacteria. And then looking at fluoride in your over-the-counter paste and the prescription products, and then the professionally applied. So a three-pronged approach for fluoride. The other new products that are out there, you probably have seen some of this advertised. This is the casein phosphatide, or CPP, and amorphous calcium phosphate, so different combinations of phosphates that enable the calcium in the saliva to be remineralized, because you can have calcium floating around in the saliva, but it's not going to be able to be in the form for remineralization to the tooth. So these products help it help the uptake into the enamel. So look for the CPP and ACP in some of the gums and lozenges that you can get over the counter, toothpaste, a lot of different things, but all designed to help remineralize the tooth surface. And here's some more information on xylitol. So this is a naturally occurring alcohol sugar. Comes from trees, fruits, and vegetables, so it's not made up in the lab. And it got FDA approval back in 1963. And it has this antimicrobial effect because it will disrupt sugar metabolism. And depending on what kind of a product it's in, it can actually help stimulate your salivary production. The thing to remember again with xylitol is that you need to have enough of it to have a therapeutic effect. So to be therapeutic, to actually be able to have an effect on the bacteria and the metabolism of the bacteria in your mouth, you need to consume between 3 to 8 grams in small amounts throughout the day. So that's the key thing to remember. It needs to be 3 to 8 grams. So you need to know how much is in, whatever it is you're using. Is it a gum? Is it a lozenge? And to make sure that it has the appropriate amount. And then you need to be using it all day long for it to be therapeutic. Now, if you're just using it because you like it, then you don't have to really pay any attention to how much all day. And it's a great sugar that has some good benefit to using it. This is a resource for information on tooth decay. It's called Carie Free. It's a commercial website, but you can get a lot of information on how to reduce your risk of tooth decay, especially following cancer therapy or during periods of xerostomia, if it's transient or permanent. They just have a wonderful assortment of information pieces so you can learn more about what's going on. So you see here, this gives you the solutions to all the different problems with tooth decay and restorative care. So the important thing to remember is that if you have a cavity that occurs, to look at what's causing it, okay, which risk factors came into play here, and then how to approach that to avoid a second cavity, okay? So looking at what your fluoride intake is, what your pH is, looking at the whole picture, not just, okay, we need to put a filling here, that's great, But you need to know also, okay, what contributed to this and how can we reduce my risk of future decay. Then looking on the perio disease side, you want to look at the different adjuncts that you've got available to brushing and interdental cleaning. So looking at reducing the overall load of bacteria and looking at your prescription rinses. So anything that has chlorhexidine in it, and looking at what's available over the counter. So the essential oil type rinses that are in products like Listerine. And then the other products that have cetylpyridinium chloride, it's kind of a tongue twister of a word, but looking at those products, they actually have some research showing that they'll reduce the overall amount of bacteria in the mouth. Because when you think about your teeth and brushing and cleaning in between the teeth, that's only 20% of the whole mouth. You've got another 80%. So looking at how to reduce the bacteria in the rest of the mouth using a rinse can be really helpful. So if you want more information on periodontal or gum disease, a great source of evidence-based information is from the American Academy of Periodontology. So their website is really helpful. It's perio.org. So I like that little logo, love the gums you're with. You got to love what you got, and you've got to take good care of it. Another source of good evidence-based information for oral health is from the Centers for Disease Control. They have a wonderful page or a set of resources on their oral health section. So when you have questions, go to the scientifically based information sites. Oral Cancer Foundation, a wonderful organization for individuals that have had head and neck cancers. And I think it's really appropriate that we have this talk this month because this is Oral Cancer Awareness Month, so April. And they've got wonderful resources for information, support, and advocacy for anyone with oral cancer. And we are also, through the Oral Cancer Foundation, promoting being part of the change. And with that, screening is the beginning of the end of oral cancer. So making sure that each time you have a dental checkup that your hygienist or your dentist is doing a head and neck exam each time. So screening and early detection will make a change. I got to put a plug in for the health library. So looking at all of our health information and videos that are available online. And then if you have a specific health question, of course, you want to put in a request for an information packet, which you can do from your computer or you can do it over the phone, and you can get scientifically based information on any topic that you want. So in terms of what the future holds for oral health and side effects from cancer therapy, looking at salivary gland regeneration and tissue engineering is where some of the research is going. So for stem cells, for being able to regenerate the salivary glands. Anyone that is suffering from atrophic salivary glands would really benefit from this research. And looking to see what's out there, going to the clinical trials page will bring up all the different research that's going on for any sort of head and neck side effects from cancer therapy. So that concludes my presentation, and I'd like to entertain any questions you might have. And otherwise, yes?
I have two.
Two, okay.
The first one is when you have a cleaning, they usually check the tongue and inside the mouth.
Uh-huh.
But when you say make sure they check your head and neck, what should
Palpating your salivary glands, your parotid gland, palpating here underneath the neck, and then the lymph nodes as well. You can ask to have that done, because the external oral exam is also part of the total head and neck exam.
So should I get a new dental hygienist if they...
You can say, I'd really like it if you would, palpate my lymph nodes. It's something that is part of the dental hygiene education, and many hygienists maybe haven't, or maybe they're no longer comfortable performing it. I can't tell you that answer, but okay.
Thank you. And my other question is that normally lemons in an alkaline diet are not acid forming. So is this just for the mouth, or?
Well, lemon will, citrus will lower the pH.
But when you look on the list, grapefruits,
Yeah.
oranges, they're alkaline,
Yeah.
promoting not acid.
Maybe in the digestive tract, but definitely, if you suck on a lemon and check the pH in your mouth,
Okay, so that's
yeah,
something completely
that would be
different.
different. Okay. Yes, sure.
Are there any health risks with certain dentures, like one that uses metal and acrylic? Have you ever heard of
Well, if it's a denture is made of acrylic. If it's a partial, so that would be an appliance that's only replacing some of the teeth, those have a metal framework and clasps, so little attachments that'll attach to the remaining teeth. So that's the difference. The denture is made of acrylic, so it's much lighter, so because it's not attaching to any tooth structure. But if you have some teeth in the arch, then you're going to need clasps that will attach the denture.
So it's metal and acrylic.
Yeah, it's a combination.
Are there any health risks? Like I have heard sometimes with plastic or
Health.
also
No,
certain
the health or the risks that you might find with a denture, or the issues with a denture or anything that's acrylic, is that you don't want to use an abrasive to clean it. So using an abrasive will put little micro scratches into it, which provide a place for more bacteria to grow. So that's why, if you're getting instructions on how to take care of your appliance, they should tell you not to use anything that's abrasive on the inside, because it promotes a greater surface area for more bacteria. Yeah.
But otherwise, like metal.
No, it shouldn't have a health risk. No. Okay. Yes.
After we put an application of a special fluoride solution on the teeth tray, should we rinse?
You want to try not to rinse. You should spit it out, and if you feel like you still have a lot of it and you're not comfortable with it, you can take a tissue or something, to wipe the excess off. The reason you want to try and not rinse with water is that if you're rinsing with water, you're washing all this fluoride off. So you want to spit out the excess and try and retain what you can. And you will still have fluoride ion floating around in the saliva.
There's no risk.
No, not with that small quantity. No. Yes.
During chemotherapy treatments, oftentimes patients are advised not to go to the dentist during that time because of blood counts are lower and risk of bleeding and infections. Is there a time after treatment, a period of time that you would recommend waiting before you re-establish those
Well,
treatments?
once your blood counts are at the healthy level, you should be able to see your dental care provider. There are also very helpful brochures. These are from the National Institute of Craniofacial and Dental Research. One is for the oncology team, and the other is for the dental team on oral complications of cancer treatment. And both of these are based on evidence and research and a collaborative effort between medicine and dentistry to come up with a protocol. Both of these state that depending on what your blood counts are, you can have some dental hygiene care during therapy. So it's really on a case-by-case basis, but in these documents it's quite clear that if you are in between chemotherapy and your blood counts are at a certain level, then you should be able to have some dental hygiene care, which, you wouldn't necessarily be having deep scaling and root planing, but definitely deplaquing and checking, for lesions and any sort of issues that you might have in regards to keeping your teeth clean can happen in between. So, I mean, sometimes when I get that kind of a question, I refer back to these that are quite clear that that you can have ongoing care through your supportive care during your treatment. Yes?
I think there's a toothpaste called baking soda, or made of baking soda. Is that a good one?
Baking soda, tends to be on the abrasive side, but it's also can be neutralizing. So it really depends on your particular situation. Pardon?
There's a toothpaste called
Baking soda, yes. There is baking soda toothpaste, and it should be just fine. Yeah. Okay. Well, thank you very much. I really appreciate you coming out tonight.